Good afternoon, everybody. To begin with, I have been told to speak about COVID-19 pandemic, a pragmatic plan for Ayurveda interventions. This was the initial talk which was assigned to me, basically. But since we have written about the pragmatic plan, it is already 2 years now, and a lot of new knowledge has been evolved so far. So I would rather be talking about the COVID-19 pandemic and its relation to Ayurveda. And I would be focusing upon the lessons we have learned, lessons we couldn't learn, we have missed to learn, and lessons we have forgotten. So we would be talking on these issues, some of these lessons we are trying to put focus upon. So this is the day when the world was initially, silently gripped by a deadly foe. We know that the first case of the COVID-19 was possibly reported in sometime in November or December 2019. Then after the first confirmed case of COVID-19 infection in India, it was reported on 27th of January 2020. It was reported there in Kerala. This is the history of the COVID-19 pandemic in India. 11th March 2020, WHO declared that it's a pandemic. WHO declared that COVID-19 is a pandemic. So in March 2020, they did it. Ayurveda, as early as on 23rd April 2020, we have published a pragmatic plan from Ayurveda. So this was basically a kind of plan which was saying that in this pandemic, how Ayurveda can really be utilized. What could be the possible implication or possible applications of Ayurveda in this pandemic? The knowledge was still evolving, but what we tried to do, we tried to utilize the knowledge which was already available in Ayurveda for its possible application in COVID-19 pandemic. What was the plan? What actually we have proposed during that time? We proposed that the cases, this COVID-19 cases can be distinguished on the basis of symptom availability and their severity, as it was being done by the modern people also. We also proposed to identify potential herbs and Ayurveda formulations which were currently used in practice in upper respiratory tract infections, basically because it was all which was starting from the upper respiratory tract infection. So our presumption was that those medicines which have been already proven to work in these kind of infections may have certain kind of role to play in pandemic also. And this plan further proposed to work independently in mild to moderate cases, which were not requiring any kind of hospitalization. We argued that in these cases who are not requiring any kind of hospitalization, possibly Ayurveda can work independently in these kind of cases, in mild to moderate kind of cases. And further, those kind of cases which were severe and requiring hospital-based care, we argued that the Ayurveda or other alternative system of medicine can work as an adjunct in moderate to severe cases which were requiring the hospital-based care. And it further proposed that it can also work as the prophylaxis for among those who have exposure but did not develop a disease. And similarly, it can also work for the prophylaxis. It can have a kind of prophylactic role among those who are still unexposed. So this was basically included in the plan, which we have recommended that it was published there in April 2020. This is quite interesting that how this paper was taken up by the whole of the world, because everybody in the globe around the world was looking forward to have some kind of applications or some kind of medications which were having any possible role to mitigate the disease or to handle the disease properly. So this paper so far has become one of the most cited and most discussed publication across the world in the area of Ayurveda and COVID-19. If you make a search, keeping this search word Ayurveda and COVID-19, you would be finding that this paper was most cited paper across the world, around the world. Similarly, it was having maximum social media coverage. Plumex Matrix was highest for this paper. It was published in JAIM, and Plumex Matrix was highest for this paper in that journal. So far, it is cited by 174. It is 172. It is mentioned here, but now 2 more citations are available for this paper. So it was cited by 174 publications across the world. This is surprising that how India took on. Although the world has taken very nicely and taken very seriously about whatever propositions we have made through this pragmatic plan. Unfortunately, in India, we didn't get any kind of attention from the policymakers or the healthcare authority. Although we tried to write repeatedly to the authorities, to the policymakers, to the healthcare authorities, and we begged them to pay some kind of attention to the propositions which have been made in this, so that at least some kind of help could be given, could be granted to the people of India or people of all over the world. Ayurveda could not play any precise role in COVID management for large part of the pandemic. In its infrastructure and human resource were used only. I mean, if you seriously look at that, how Ayurveda played its role in the management of the COVID, unfortunately, there was no specific role of Ayurveda. It couldn't play decisively in management of the COVID. What was basically done? It was the infrastructure and it was the human resource of Ayurveda which was used as the ancillary support for the management. In face of the unclear policies, this was also unfortunate that for large part of the pandemic, the policies were quite unclear that where Ayurveda actually stands. I mean, what is going to be the possible role of Ayurveda in managing the COVID-19? So large part of that pandemic, it was unclear policies, and for that reason, Ayurveda, including its infrastructure, couldn't be used properly. And at many of the places, including my place here in Uttar Pradesh, a large number of the hospitals of Ayurveda remained shut during the lockdown phases. So they couldn't be utilized. Their manpower couldn't be utilized. In a bid to quickly secure its place during pandemic, few Ayurvedic formulations were ironically projected as immune protectors, enhancers, and modulators, and have been campaigned as a public health initiative from Ayurveda, from the government itself. The practice is still continuing. Unfortunately, up till now, there are no conclusive evidences, or there are no conclusive serious researches which are proving that yes, these formulations or these things are really actually doing some kind of help in these conditions. Few procedures also were projected as infection protectors, especially the COVID-19 infection protection. Unfortunately, none of such promotions had their logical basis and have never been tried to be proven thoroughly and subsequently. In the pandemic, Ayurveda became a victim of iniquity by healthcare authorities and inflated self-esteem of Ayush policymakers. I mean, both way Ayurveda got harmed. It was a victim of iniquity by the healthcare authorities, the modern healthcare authorities, and it was also the victim of the inflated self-esteem of the Ayush policymakers. Ayurveda survived during pandemic on leftovers where people disowned by modern medicine relied upon Ayurveda. How Ayurveda survived during the pandemic? It was only because of the people who have been discarded or disowned by the modern medicine. They tried to get a kind of respite from the Ayurveda, and Ayurveda helped them a lot. This is what we really have observed. This is also quite interesting to see that how mainstream medicine behaved during the pandemic. Mainstream medicine primarily played as the being sole custodian of the country's health, as it is being played. I mean, it is playing almost of the time. Mainstream medicine was busy making these speculations and repurposing the drugs in a bid to find something of real worth. At the same time, when they were making speculations and repurposing their own drugs. At the same time, they were also busy discarding and disrespecting and disallowing the claims or propositions made anywhere outside the realm of modern medicine or modern healthcare, including, I mean, they were discarding anything which is coming out of the modern medicine. So what kind of lessons we have learned so far in the pandemic? So there are certain specific lessons which we could learn so far. The first lesson is that there are no definitive cures available so far for SARS-CoV-2 infection. Even after 2.5 years of the pandemic ongoing, there are no real cures on the board. I mean, we still do not have any kind of a specific medicine which is claiming that it is going to cure the infection. Healthcare research always begins with a hypothesis. We know that it is, I mean, every time we begin the research with a hypothesis, sometimes it proves to be right and sometimes it is not. We see number of medicines proposed and claimed initially with much hype and which eventually failed and lead to adversity. So it's a common thing. I mean, it's a research outcome, and it happens when you do research. You are bound to fail sometimes, so it's quite natural kind of thing. Pandemic is taking its own course across the world. This is also what we have learned now. The associated waves are continuously emerging. So second wave and third wave and fourth wave and subsequent waves are bound to come. So we have to be ready, and we have to, I mean, be prepared for that also. The causative virus keeps on changing its genomic sequences through mutation. This also we have learned. Every time we see a new genomic sequence or new genomic pattern of the virus, so this makes every new variant completely unpredictable for its virulence and net impact. This is also something which we have. The viruses are changing every now and then. Vaccines are not the guarantee. This is also, I mean, the latest understanding that vaccine cannot guarantee or cannot safeguard you completely. They cannot protect you completely from the infection, because there are instances that those who are vaccinated can also get infected, and they can also have the severe infections. Course of vaccine and its schedule is not yet clearly known. There is much speculation and the knowledge is still evolving. So still we need to learn a lot. We are learning, we have learned certain lessons, but we have to learn a lot more things. What we fail to learn, this is quite interesting, that I mean, despite a number of things which might have been happening across the world, we fail to learn sometimes some things, and we fail to admire something also. We fail to learn how TCM, this traditional Chinese medicine, possibly help. We do not endorse their claims that the traditional Chinese medicine actually helped them curbing the pandemic, but it is quite interesting to see that what kind of role traditional Chinese medicine has played there in China in management of the COVID-19 pandemic. So this would have been a good lesson for India also, because India has a big repertoire of the traditional system of medicine. What individual success reports having treated with Ayurveda and other healthcare systems have spoken about. This is also quite interesting. Nobody bothered about it. There are 23 case reports from Ayurveda published, available at PubMed, where the claims are being made that the Ayurvedic system of medicine has offered a kind of cure in COVID-19 cases. 3 case reports are available for homeopathy, 3 case reports are available for yoga and naturopathy, and 1 case series is available from Unani. Nobody bothered that what these case reports are actually talking about. These are the documented reports, and these documents are available at PubMed. So we didn't really bother. We didn't try to learn something from there, and we didn't admire it also. In majority of the cases, the disease was found to be self-limiting in nature. The treatment in such cases was only supportive. This was also one learning, but we didn't admire it, because we know that number of viral infections are self-limiting in nature. You provide the treatment or you do not provide the treatment, it doesn't really make a very big difference. Those who had the severe course of illness required the technology-based, where the modern medicine actually comes, plays a role. It was only the technology-based vital support which played the biggest role in the management of the severe course of the illness, in order to allow the tide to pass. So this was also a big message, but unfortunately we didn't realize it. We did admire it. A substantial amount of the people in the country could not be diagnosed. It's a very, very big thing that in a country like India, which is having 1.3, 1.4 billion population, huge amount of the people could not be diagnosed or could not be treated for this infection. They, however, did well and they remain safe. This is also quite important observation, that everybody who was suffering with the disease couldn't get a proper diagnosis or couldn't get the proper treatment, but they remained safe. So how they did it? And despite of declaring various risk factors like age and comorbidities, as it was done initially, that this age would be a kind of having a risk factor, or these comorbidities, if they are available in the person, they might be having, they might be increasing the risk factor. Many who had these kind of, this age bar or these comorbidities, they did well. And many who didn't have any kind of risk factor, they succumbed to the disease. So this is also quite cumbersome to understand, that what actually plays a definitive role to decide the fate of the disease. Who are going to succumb to the disease and who are going to remain safe in the pandemic. What we could see but preferred remaining ignorant. This is also, we might have seen it, but we didn't bother about it. We remained ignorant. What are these factors? Besides allopathic system of medicines, there are 7 more healthcare systems in the country who have their official recognition and have permission to practice. Nobody bothers about it. But it is not only allopathic system of medicine. There are 7 more healthcare systems which are having their presence in the country, and not only presence, but they have their official recognition and have permission to practice. A large proportion of elites in the country, including bureaucrats and allopathic physicians, took a respite in Ayurvedic medicine. This is my personal observation. I I have been inquired from so many people during the second or third wave to take some help from the Ayurvedic medicine. And these inquiries were being made from top class bureaucrats and top class allopathic physicians. And they were asking for some help from the Ayurvedic medicines. Unfortunately, when it comes to put the credit to the Ayurveda, nobody give the credit for their health keeping to Ayurveda. Huge number of people have consulted Ayurvedic physicians during various waves of the COVID-19. Such consultations were sought for the people admitted in ICU. We have seen many such kind of patients who were there in the ICU, and the modern physicians or the modern medicine have given up. They told that they do not have any kind of hope. They started looking at some alternative remedies, maybe from Ayurveda. And many of such consultations resulted in optimal recovery. I mean, they got discharged from the hospital fully recovered. We have seen, I have number of such cases. Few of such cases I already have published in the form of the case reports. So these are of documented cases, what I'm talking about. Huge number of people living abroad have consulted Ayurvedic physicians for the care and safety of elderly in their family. I mean, we know that number of people, number of young generation is living abroad, and their families, their elderly are living here in India. They were really worried about that, what is happening to their parents here who are living here in India. They have started consulting for some of the Ayurvedic medication from some Ayurvedic consultants. And many of such cases, many of such consultations also resulted in optimal recovery. So these are also the findings, but we didn't took a note of that, and it remained ignorant. These findings remained ignorant. What we have learned, but soon we have forgotten. We have learned, but I mean, this also didn't got into our minds. Although there are risk factors involved in defining the prognosis of the COVID-19, this is not the ultimate knowledge, because we already have talked about that there can be comorbidities, but the person can remain healthy, and there can be no comorbidity, but the person can succumb to the disease. So the knowledge is still evolving. We do not know what is actually playing the role. Individual susceptibility plays a significant role in determining the intensity of the infection, rate of recovery, and net outcome. This is also one very important observation. There had been clear instances of middle-aged people having no comorbidity dying of COVID-19, and elderly having most risk factors surviving the infection. This also we have observed. This observation clearly indicated for the heterogeneity of the population. We know that no two people are similar on any ground. So there is a heterogeneity of the population in terms of its response to a common infection. Ayurveda precisely define it as the rogi bal or the individual strength, comparing to the roga bal or the strength of the disease. This becomes the basis of individualization of therapy in Ayurveda. This was also one very important factor, very important aspect, but this was also didn't get noticed. Now, a very important or very interesting paradigm of 30% from 100%. There is a kind of conviction that what if 100% people get 30% relief from some intervention, and how this is different from 30% people getting 100% relief from the same population. For example, we are having 100 people suffering with the same kind of disease, and with some kind of intervention, out of 100, 30 people get completely recovered. So this simply says that this whole population, this whole chunk of the 100 people is not a kind of homogeneous population, but it hits a heterogeneous population, and some of them are going to get recovery and some of them are not going to get recovery from the same kind of intervention. So what would be the most important thing, or what would be the most important take-up from this? That these people who are getting the 100% recovery, they should really be identified, and the kind of intervention should be reserved for these kind of people. And those who are not recovering, some other kind of intervention should have been tried for them. So it would be a kind of subpopulation based study which should have been done. So this paradigm was very important during the COVID-19 pandemic, but unfortunately this was also didn't took a notice. A very important question was that how these biomarkers defining good or bad prognosis are individualized. What makes them expressed in some and remain dormant in some others? This was also quite important. And another highly relevant question is, can some lifestyle or health keeping intervention help mitigating the biomarkers proposing a bad prognosis? If somebody is having a kind of biomarker which is proposing a bad prognosis, are there certain kind of, not of any pharmacological intervention, but are there some kind of lifestyle or health keeping interventions which may help mitigating these biomarkers to reach to the normal levels. So what is the biggest quest of now? The biggest quest of now is, can we biologically screen the people susceptible for more severe course of COVID-19 before they actually catch the infection? This would have been a very, very interesting kind of epidemiological study, that how to identify and how to define the people, not only from the perspective of the risk factor, but from biologically. I mean, how can we biologically screen the people who are susceptible for more severe course of infection before they catch the infection, so they can be prevented? I mean, if we can identify something like this. Leads to this question may come from genomic studies, finding the genomic basis of various prakritis which are defined in Ayurveda. Various omic studies, including metabolomic studies, can also be of great help if randomly done upon a sample healthy population before they catch the infection. This will help knowing precisely the metabolomic markers dominated in the population, who subsequently catch the infection and follow a severe course. So this would have been a wonderful kind of a study if we do it now. What kind of possible help we can get? We could have, we could have taken from Ayurveda during the pandemic. This could have been the direct help from its formulation for the prevention, for the management. In management, this could have been a kind of a stand-alone kind of approach. This could be adjunct kind of approach. This could have been a kind of complication prevention. This could have been a kind of complication management. For example, I would share one very interesting study which we did. It was nasal saline irrigation in mucormycosis. We have seen a case of nasal mucormycosis where we have recommended a specific Jalaneti procedure. Jalaneti is a yoga procedure where the cleansing of the nasal passage is being done. So we tried this because, I mean, this gentleman who was suspected to suffer with this disease couldn't get a bed in the mucormycosis ward at the medical college here in Lucknow. So in the meantime, for 3-4 days, he was to wait for 3-4 days. And in the meantime, we asked him, he tried to have some kind of consultation from Ayurveda, and we recommended him to have some nasal saline irrigation or the Jalaneti 2 times in a day. And to a great surprise for all of us, in 3-4 days, these 3-4 days, when he was waiting to get admission in the mucormycosis ward, his infection was almost recovered. I mean, the moment he reached at the mucormycosis ward, he was not having any specific sign or symptom related to the mucormycosis. And even the nasal swab for the fungal infection, when it was taken, it was also not able to find any mucormycosis there inside. So, I mean, these kind of things which can really help not only prevention and management, but they can prevent the complication, and they can help in management of the complications also. So much help can also be derived from Ayurveda fundamentals to develop a better understanding of about the disease, its prevention and management. So the final submission is that, I mean, this was really unfortunate that Ayurveda couldn't get a chance to act properly in the pandemic. I mean, I am simply imagining that what if Ayurveda could have dealt with this infection in a one-to-one manner. And I strongly believe that the world would have been a different place today if Ayurveda could have been given this kind of opportunity to act in time. Thank you. Thank you very much.